Well, I thought it was more like something that occurred to me recently, and I was reflecting on a statistic I heard, and it's a little bit complicated in terms of a statistic. The Center for Medicaid and Medicare Innovation, CMMI, is now instituting prior authorization in traditional Medicare. There wasn't much prior authorization in traditional Medicare before. And they're starting this program called Wiser, which is focused on 10 or 12 areas where they see sort of wide variation in utilization. And they think a lot of that utilization is not value-based. And they recently had an analysis of their data. And the thing that struck me was they looked at by state the number of dollars that would be involved per Medicare beneficiary for these 10 or 12 areas that they were looking at. And the state variation was incredible. The lowest state, CMS was going after $12 worth of benefits per beneficiary. And in the highest state, Nevada, they were going after $1,200. That just means that the 10 or 12 different kinds of procedures that they're looking at are used 100 times more frequently in Nevada than they are in Vermont. And I thought that is just such a comment on the American healthcare system. Point being, where there's that kind of variation, there's the ability to say some of that variation is not legitimate and should not be occurring and is costing us money, and that's where value-based care comes in.